Thank you, Lisa, and welcome to week 7 of our athlete series. So my task this week is to talk a little bit about injury prevention in sports. And the reason we're all here is that education is really at the core of sports safety. I've really had a focus of that in my career for the last 20 years. And what we recognize is the best thing to do is to reach out to the persons of influence. And those of you that are on this call are those people. We talk about medical clinicians all across the specialty of sports medicine and beyond, including our exercise physiologists, our athletic trainers, our physical therapists, my fellow colleagues in orthopedic sports medicine, and our primary care physicians and pediatricians that work with you each day. The parents are certainly key, especially in our athletes that are under 18. Youth sports organizations and the leadership of those groups, as well as the coaches, are key influencing factors in helping us help athletes prevent injuries. So how important is this? I mean, this is really important. From an economic standpoint for our country and from a number of people involved, we're talking about 12 million student athletes currently involved in sports from age 5 to 22. About 20 million lost days of school happen because of sports-related injuries, and about $33 billion are spent on injury-related medical costs. Now, economics are one thing, but individuals are an entirely other thing. And the most important thing is the athlete in this whole issue. And if a child has a history of a significant injury, it's the #1 primary risk factor for future injury, both during their youth and adulthood. And it can be a contributing factor to some long-term degenerative diseases such as osteoarthritis. Now, when we talk about injury prevention and performance improvement, there are things we can control and things we can't control. So, now, certainly genetics are something our youth athletes can't control. The second thing is just the chance of competing. Injuries will happen in sports. But when it comes down to protecting athletes through working on their mechanics, their preparation for their sport, and their conditioning, that's where we can really have a significant influence. Now, what we know is that by and large, there's a little bit of a lack of coaching education on this topic. We know that there are some hazards out there, including playing fields and weather conditions, and some of those things are certainly controllable and not controllable. And we know that athletes are going through a period of growth. We know in general our population in the U.S., our kids in general have declining fitness levels at baseline. And they make conditioning and training errors because really we're a society of excess. So if we do get involved, often we do too much. We are guilty of having our kids play injured or overtrained, and some of them show up to the practice field without that proper nutrition or hydration that we've covered in previous sessions. So what do I see in my office? And I refer to it as the big 3 in sports medicine. And the big 3 are the 3 O's. So if you take something home today, take the big 3 home. It's overuse, overload, overexertion. And we're all charged to work with our athletes and their families and their coaches to try to make a difference in how we control those 3 O's. Now, overuse, overload, and overexertion can happen in any sport, particularly sports that are practiced or played year-round with something called a limited periodization. And the individuals that are the highest risk of these injuries are our highest performing players. It's the kids that are bigger, stronger, faster, they throw harder. They love the game, and they're willing to play year-round, and they're willing to play for multiple teams, and they're willing to do extra instruction. So those of you that are on this call as athletes and are those players, or the coaches that are watching, you can recognize pretty quickly who those players are that might be at risk for those 3 O's. So how do we prevent them as a team? I think over my 20-year career, I think I can really center that down on 3 major impacts that we can have in terms of injury prevention. One is to incorporate an injury prevention program. The second is for everybody involved to understand the importance of something called periodization, or a training cycle. that helps an athlete progress through a year where they train to build a foundation of fitness. They continue but change that training as they go into their preseason or competition year. And we'll talk a little bit more about that in a minute. And the last is to avoid something called early sports specialization. Playing one sport and only one sport year-round, under the age of 14 in particular, can be detrimental to an athlete's development and eventual progress, and really the ceiling that they can reach in their sport. So let's talk first about incorporating an injury prevention program. It actually sounds pretty easy. For non-contact injuries, and specifically ones that cost a lot and will cause athletes to miss the minimum generally of one season, is an ACL prevention program that would have multiple components, which include lower extremity plyometrics, and the workout later in today's session will be an example of that. It includes some dynamic muscle balance, strength, stretching, body awareness, and some targeted core and trunk control. And really each of the workouts that we've put together in this virtual series can qualify in terms of workouts that have those components. And these are critically important both in the preseason and for in-season maintenance. So we know some things about ACL prevention programs. We know they really need to occur in the preseason to start to have any effect. And in season, we need to continue that participation, typically a minimum of 15 to 20 minutes at a minimum of 2 to 3 times a week. And so the goal here is to prevent the highest risk of ACL injuries and what we call non-contact injuries. And we want to decrease the landing forces that an athlete's knee sees. We want to decrease something called the varus valgus moments at their knee. And we want to increase the effective muscle activation or protection those athletes' bodies are providing for the ligaments within the joint. And I can tell you the two biggest challenges are number one, time, and second, compliance. And there are some studies that bear this out. First one thing I want to share is that if you commit to an ACL injury prevention program, there is a high likelihood that you will have a decreased and significant protective effect of that program and reduce your rates of injury by as much as 50 to 60%. And we know that ACL injury prevention programs may be able to be designed with an overarching best practice framework, a little bit what I talked about, and does not have to be a one-size-fits-all or one-size-fits-one-sport program. You know, there are many examples out there of ACL injury prevention programs. You can actually Google some online, but what we did in this series is tried to show one that's both efficient and effective and has been studied across sports. So the one we chose to use is called the FIFA 11 Plus. It was described earlier in the series. It's a 20-minute investment of time, consists of 3 parts and 6 different sets of exercises. It combines speed with running and sport-specific movements and sudden changes of direction. Now FIFA 11's been studied across the world, and there are physiologic effects of the FIFA 11 program that extend beyond its prevention program, and it has to do with performance. You know, within 9 weeks of doing the program, 3 times a week, there were induced improvements in overall neuromuscular control. And implementation and adherence is critical, and the improvements that are seen are based on that dose. So it's important. And the cost effectiveness of this training is relatively low compared to the costs associated with the potential surgery and time out that goes along with these injuries. And important to coaches and athletes. In studies in Europe where FIFA 11 Plus was implemented, their teams actually had more wins than losses in comparative groups that were not participating in this program. Now, for females specifically, there have been decreased uses or decreased numbers of both overuse and training injuries, as well as acute injuries, and less overall ACL tears. And that was in a study of college female soccer players. And in randomized controlled trials with males, there was 46.2% less injuries, less ACL injuries, less hamstring injuries. And that was a study of male collegiate athletes in the U.S. Now, since the time of those two publications, FIFA 11 has also been used in professional baseball, and the Los Angeles Angels organization saw a significant decrease in hamstring injuries across their professional system using the program. Now, with 5 studies in the U.S. Specifically on FIFA 11 and a Swedish study that involved a nationwide effort that showed risk reduction, I need to be clear that the data here is not perfect, and I'm going to explain a little bit why. So there was a study published this year, or last fall I should say, regarding implementation of FIFA 11 as an injury prevention program in high school athletic teams. And the findings the authors had was they did not reduce lower extremity injuries overall in a clustered model. But let's talk about that study and talk about actually what the authors found. One was that they looked at all injuries, and those included bruises, those included bumps, those included sprains and strains. It didn't just include serious injuries to the knee or ankle. And the most important take home for me of this and some other studies in this regard is that coaches reported compliance with performing the FIFA 11 Plus at least twice a week was very low. And I think that's a very important thing to address. And we need to work with you and your team and your athletic trainers and those that your support staff to see if we can find a way to implement these programs in the preseason and make that investment in your athletes during the season to help control the risk of injury. And so how can we improve in the future? First of all, the authors suggested this. Number one, the recommendation was not to have FIFA 11 program, plus program taught to coaches and implemented by coaches the first time. Rather, we work as a team together and have our professionals work with you and your athletes out of the gate so you get comfortable with the program, so you're able to implement the program, and you're able to keep the athletes performing the program at a level to where they're not making mistakes, they're not taking shortcuts, and they're maximizing the benefit. So that's a way our team can work with your team to implement the programs. And please, through this virtual series online, reach out to us in that regard. We also recognize that this type of approach is going to require some considerable resources and acceptance by your athletes, your community, and coaches have been doing their way for a long time. And we want to be part of helping us all get better, particularly to support the athlete. And we really feel that increasing compliance with injury prevention programs such as FIFA 11 or other are going to really benefit the athletes in the back end and help them perform exercises correctly and get the biggest bang for their buck with time. So I mentioned the second thing is understanding the importance of periodization and what that means. Now, I've said in many of my talks, we are a society of excess, and oftentimes a young athlete looks like this, or a young athlete's day looks something like this. And it's really the professionalization of youth sports. You wake up, plus or minus breakfast, off to basketball practice, followed by private instruction. Maybe they're a multi-sport athlete and they go to soccer practice after that because they're both in the off season, a fast food dinner on the way to the next event, followed by that tournament that goes all weekend with 1 to 3 games a day, and you repeat the cycle 6 to 7 days a week. Now, high achievement for these kids has become paramount, but if you walk back through this virtual series and you walk through their day, there are some key mistakes that they've made in their daily cycle, and it often carries into an annual cycle. So our goal in a periodized program for sport-specific training is to have components of the year that allow an athlete to build that solid foundation first. And we'd refer to that as training to train. And then we're training to compete in some ways. We're focusing still on that athleticism over skills. and then training to be ready for preseason, and then certainly a maintenance program through the season. Because without basic elements of athleticism at the beginning or the base of that pyramid, players are unable to master the specific skills that they need for their sport, and they're at a high likelihood of breaking down. Now, when it comes to addressing movement imbalance in sports, particularly sports like tennis and baseball and softball and repetitive movement activities, oftentimes imbalances are developed left to right. And one of the goals of off-season training and training to train is to overcome those imbalances that can become detrimental to the athlete's development and their performance. But we also, in that, incorporate some unilateral training techniques to improve their proprioception and body control. And you're going to see a good number of those unilateral proprioceptive techniques and body control exercises in the workout that follows this talk. So the way we build this strength in the off season and build off single legs and adding balances is effective, and it's using things like reverse lunges, single leg Russian deadlifts, and single leg hip thrusts. You'll see some of those in the jump landing techniques we're going to do. But then in the weight room, we also have to make sure that our athletes are monitored as they're doing these techniques, and we're cueing them in on some collapses that are detrimental to their movement patterns. So we need to understand that it is the athlete's responsibility, the coach's responsibility is to the best way to incorporate that time and that supervision into that training plan. And one training program that carries through and goes to every athlete on the team is not necessarily a best fit model. So our team here recommends some individualized training that starts with a motion screen and a movement screen where we pick up the imbalances and we tailor those exercise programs to each specific athlete. Again, one size does not fit all when it comes to training to train in the training cycle. Another thing to keep in mind with a training cycle is that when an athlete lifts, he or she is spending valuable energy that they must pay back via recovery before going at it again or into the next time. It's much like paying back a debt. So training hard in the off season and competing in the off season often can set you up for a challenge, and that's why in season we back off on some of the intensity of the conditioning program and some of the volumes and some of the weight to allow that athlete to maintain their balance of productiveness and their balance of good health. So in the off season, every athlete deserves a shutdown period for some active rest, and that's a really key time in every training year to have a period of active recovery. So that's typically followed by that heavier lifting schedule. And right now, as we've gone through a period of many athletes being away from their sport, we actually have moved in over these last weeks away from an off-season program into a preseason program as sports are beginning to get up and get ready to go for the fall season to come. So the training should become more about agility, power, and ultimately cycle into maintenance over the next few weeks. So the last part is in preventing injuries that I wanted to touch on tonight was what is sports specialization. And sports specialization is defined as engaging in a sport for at least 8 months per year or approximately 3 seasons per year at the exclusion of other sports. And so year-round participation in a single sport, usually at the exclusion of other sports, has been studied now over about 30 years. And there are 5 big questions really about specialization. Number 1, is there a right way to specialize? 2 is how much is too much? 3, is there a right age to specialize? What's the best way to make decisions about specialization? And how does it ultimately influence health in a later life? And key questions from athletes and parents are a little bit different than those, the ones that often medical professionals ask. They want to know, is early specialization necessary to achieve success? What are my injury risks if I go out there playing only one sport? And what's the effect on me on the long term in my sports participation? Well, what we know about specialization is that it's increasing across the board and has been doing so for the last 20 years. And it's really been complemented and follows the economic trends towards increasing numbers of travel leagues, accepting participants at even younger ages. And there are concomitant increases in the number of athletes playing that single sport, with 30% now highly specialized by the time they reach high school. So why decide to specialize earlier, or who makes that decision? We know it's multifactorial. Some is self-determined. About 25% of individuals in some sports will say that, but often parents make these decisions, particularly at the youngest ages. And its relative potential for success is noted as a reason why, and it's still unclear in many times who drives that, but certainly family member influence and coach influence play a role. Is early specialization important to get me where I want to get to? And that may be a college scholarship, that may be professional sport. And the answer to that is clearly in the literature, no. Late specialization actually has been shown to have increased performance benefit, decrease in overuse injuries, decreased risks of social isolation, and increased intrinsic motivation and enjoyment in the sport, and decreased burnout. So please, I'd ask you to encourage sports sampling rather than specialization. With all we've said about the sports specialization, our team at WellSpan Sports Medicine has done research in professional athletes and has found across the board in high-level NCAA and Olympic wrestling, professional baseball, all that individuals that specialized early had increased risk of injury and increased risk of serious injury later on in their careers. So what we can conclude from this data is that with the exception of some early peak performance sports, that there's really no strong evidence that early sports specialization is a requirement to achieve elite status. And the literature is linking early specialization to increased injury risk. We know it's a risk factor for burnout, and coaches and parents play a strong role in developing athletes and making the decision to specialize early. So what are our recommendations? Recommendations are that we need to limit training and competition in a single organized sport to no more than 8 months a year. We want to participate in fewer hours of organized sports per week than what is the athlete's age. We want to participate in that organized sport fewer than 16 hours per week in any youth or high school arrangement, and try to take 1 to 2 days off from an organized sport per week. We can participate in 1 hour of free play for every 2 hours of organized sport. We're certain to see a decreased risk of overuse injuries. So at the end of the day, our goal in sports medicine and your goal as coaches, parents, and athletes is really to find that balance. And it's so like having an elephant balance on a stability ball. But that balance needs to incorporate fun, training, recovery, and ultimately success. And we hope that this virtual series for you this week began to stimulate some of those juices, some of those thoughts in you that will have you ready with a new outlook on the seasons to come. So let's get ready for today's workout. If you have questions, you can certainly reach out to me at jdeitch@wellspan.org. And I'm happy to follow up with you in more detail on any of these topics or any questions you have related to sports medicine.